Okay, we are live. So, good evening, everyone. Thank you for tuning in for the health show this evening. We apologize for making this broadcast a little bit late than we usually do. The reason is because many of us had some. Anyway, let's just leave the excuse part. Okay, so we have
Yeah.
with us today. We are going to talk about male contraceptive in general, um, male and female contraceptive. We're going to know which is better and who we advise among the partner who we advise to use the contraceptive. So we're going to be throwing more light about the male contraceptive, if there are, and then the female contraceptives. And if you are listening as a man or as a woman, it will be necessary that you jot down. If you have any questions, you type in the comment sections and we'll address it. Any questions regarding contraceptives in general. So let's introduce the guest in the house. Oko.
Okay, hi guys. My name is Oko Anastasia. I'm a pharmacist. Been
Okay.
practicing for about 2 years now, or a little
Okay,
more.
you're welcome. Mr. Robert.
Thank you.
Yeah, good evening, everyone. I'm Robert Abachi. I'm a socioeconomic analyst.
Okay, thank you very much. So, Famoko, what is your general comment about contraceptive in general, commenting on both male and female contraceptive?
Okay, first of all, I think we have to know what contraception is generally. I think it's
Okay.
a very familiar term. So when you think
Yeah.
contraception, you think ways to have sexual intercourse without
Okay.
forming or fertilizing an ovum. That's pregnancy. And I think there's over or about 15 different ways to practice contraception. The most common one would be the condoms, and then the contraceptive pills, the one that's commonly called the morning after pill. Yes. Then you have more permanent solutions like sterilization for male and female. Then under the other 15, you have caps, diaphragms, you have contraceptive injections, you have patches, then you have what they call intrauterine devices and the likes of it. So we have like a broad scope when it comes to contraception, not just the regular condoms that everybody's familiar with or the contraceptive pill. Um, I think it's a very delicate topic for some because besides the medical aspect of it, right? People have their religious beliefs when it comes to using contraceptives as well. So it's really delicate. That's why the question of it should it be male or female taking the contraceptive is really dicey because I feel it should be an agreement between both parties. Because taking contraceptives comes with a lot of side effects as well. For the female particularly, you have side effects like headaches, you have breast tenderness, you have your menstrual cycle shifts. It comes earlier, later, or in some cases not at all, or it stays longer than it should. You have such side effects for that. So I think considering those factors for the females is very important because that's a lot of side effects to go through if you ask me, speaking as a female.
Okay.
Then for the males, I think the most common option the guys go for should be condoms. And if I'm speaking from facts, I think condom is one of the safest contraception or method of contraception because it doesn't just prevent pregnancy, or it also prevents STIs, right? But the
Okay.
pills, they don't. The pills just prevents it delays ovulation in some cases. They also prevents fertilization of the ovum, right? But the condoms on its own prevents the sperm from going in the first place and also prevents transfers of STIs between partners. So it's like really safe if we're talking about like the safety index. And I think research shows that most, not all of the methods of contraception, they're about 96 to 99% effective. So considering that, that little 4% can be very dicey, and you're surprised that that tiny 4% is the 4% that affects you, not the 96%. So that's that.
Yeah.
The male contraceptive pill is something that is still being studied, is in research. From what I studied online, I saw that they found a pill. They've actually developed one, but it's not in circulation as much as the morning after pill, the one we call morning after pill for the females. Yeah, that one is a hormonal pill, sort of, that delays ovulation. In some cases, it prevents fertilization as well. So for the male contraceptive, it's not exactly a developed medication. I wouldn't say it's there. It's not in circulation as much. So taking that into cognizance, I would say for the contraceptive pills, for now, until research is done better, and we have more details on how it affects the male reproductive system. I think the females have to be on that side. But for condoms, we know they have the male condoms, they have the female condoms. So that one now has to be an agreement between both partners on who should wear the condom. I know the female one can be very discomforting for the females. Yes. So that's that. So it has to be a discussion you have with your partner to decide whether he wears it or she wears it. Then I think the frequency at which you have sexual intercourse matters as much. Because like I said earlier, the side effects on the females is a whole lot. So if you're like regular at coitus, you want to consider that your partner, the woman, now goes through a lot of changes in her body every time she takes these pills. And the pills also, they're used for management of other diseases on the side. I think you have the PCOS, polycystic ovarian syndrome, right? To balance the hormones and get the menstrual cycle flowing regularly. Then there's also the endometriosis one. So you don't want to overtake the pills and abuse it just in case you find that you have one of those conditions. And you're a pharmacist, so you know how loading the drugs in your system too much can affect the treatment if you have to use it for a treatment. Yeah. So generally, I think that's my thoughts. Then about, like, people talk about how do you know the best contraceptive method for you? There are different factors to consider. You have to consider your age, you have to consider your health, you have to consider the lifestyle, and most importantly, like I've been hinting, the side effects, especially on the women, because I know what we know commonly is the female contraceptive pill. So you have to consider those things. And then lifestyle mostly revolves around the fact where I said, if you have coitus regularly, that's your lifestyle. You have to consider that. And then health, because some people have medical conditions, like I mentioned now, the PCOS and the endometriosis, and they need those pills to like balance their hormones. So you don't want to be using the pills to balance your hormones, and then at the same time, you're using it to like monitor your pregnancy or fertility rates, that kind of thing. Then I think finances is another important one. I know condoms, we have a range of condoms. Like you have different brands and they range from different prices, from the lowest to the maximum. So it's sort of it's almost like it's the most affordable method of contraception. I think the pill is not very expensive as well, but if you still consider compared to the amount you can get condoms at, I think condoms are still the cheapest one. So you have to consider that. And then you have the age factor too. Yes, as women age, we know we go towards like menopause, and your menstrual cycle is already shaky. So you don't want to make it worse. Let me just put it like that. Because one of the side effects I mentioned was the irregular menstruation. It either comes later than expected, earlier, or it stays for longer than it should, or shorter. So those are factors that we want to consider before picking our choice of contraceptive. Yeah.
Okay. Thank you very much. Thank you very much, pharmokoh. You mentioned something while you were talking. What's the right frequency? What's the recommended frequency of taking this contraception, especially for the ladies?
Okay. I know the earlier you take it, the more effective, of course. But even if you do not take it like at the get-go after intercourse, you have 3 to 5 days window to take them. But it's said that the earlier you take it after sexual intercourse, the better. I hope that answered the question.
Yeah, that's it. And some persons usually, how frequently do they have to take it after every sex? There's a person who have they have sex like twice or 3 times in a week.
Yeah, the
are they
regular
supposed to
guys,
take it?
lifestyle.
Are they the regular guys? Yeah, are they supposed to take it every after every sex? Let's say they have on Monday, they take post-nut 2, which is a popular one. They have on Wednesday, and they have on Friday. So are they supposed to take it that frequently?
Okay, we have to think medically about this one, right? So if we have a window of 3 to 5 days to take the pill, then I think if you're having sexual intercourse as frequently as you mentioned, say Monday day 1, Tuesday day 2, Wednesday day 3. So it means you've gotten to, let's say, the minimum safety window now, right? That's day 3.
Yeah.
Then you have Thursday and Friday, that's the 5th day. Then you have, that's the maximum. So within those 5 days, you can take it on the 5th day, but it's not safe when you do that. You can do it like that if you're following the facts. Yes, because it says 3 to 5 days, but you find that within that 3 to 5 days, fertilization can occur.
Okay.
Yes, if
so
the person is
you are saying if the person, if you're saying that after sexual intercourse, a person can stay up 3 to 5 days and then still take they post, and there's a chance and there's a percentage of it working.
Yeah. That's the 95% scale I mentioned earlier.
Okay.
But the safer practice would be to take it immediately after coitus.
Okay. Now, Mr. Roberts, I don't know, what do you have to say concerning the fact that there are no male contraceptives? At least Dr. Pharmokoh has told us that there are no male contraceptives currently in the market. They may still be going through clinical studies. How does this go well with the society, and does it not align with the much held ideology of women being sidelined, and men putting the responsibility of getting pregnant on women, and many other rambles we have in society today?
Right. Yes. Society is ruled by consequentialism, where what is right, what is wrong is just based on the consequences of it. That is the reason war is okay and all that. So in the case of contraception, the consequences are usually heavy on the female than the male. So there's this natural way we think as human beings, where the people who are more affected by a consequence are given the responsibility to mitigate those consequences. So now, if there's an unwanted pregnancy, who does it really affect more in the society? First, if they are unmarried, it affects the woman more than the men in society. Is what we've seen. There's this stigma that comes with it. But when a man has a child out of wedlock, it's not that much of a big deal than when a woman does. It also hinders her career, for instance, or if she's in school, because then she bears the physical burden of raising that child, while the man is just free. Also affects her lifestyle. So all these consequences rest heavily on the woman than the man. So we just naturally feel that, okay, it's up to the woman, even though it should not be the case.
Okay. Okay. And now, coming into this matter medically, Pharmokoh, if there are some of our viewers who are currently faced with the fact that they need to use contraceptive, but maybe their sexual partner or their husbands are unwilling for them to use contraceptive. How do we go about this kind of conditions, or what are there any provisions made for medical professionals to address situations where a woman or a wife or a partner is trying to prevent a pregnancy, but the other partner are not collaborating, or they're not doing it together? What do you think?
Speaking from a medical perspective, it's outrageous. Yes, because that's the point of contraception, right? To prevent a pregnancy from occurring. So if you're engaging in sexual intercourse and you don't have intentions of starting a family or giving birth, simply put, then you have to choose a means of contraception. If he doesn't want, let's say the first case scenario, he, being the man, doesn't want his partner, the woman, using contraceptives, then he should opt for one. If she's the one that doesn't want him using, say, condoms, since that's the most commonly one for male, then she has to take preventive measures. If there's a breach, and say, for example, the partner, the male one, doesn't want the woman taking any form of contraceptive pills or using a female condom or the patches or taking the injection, then they have to see a therapist, because there's a breach in the communication there. Because I know I don't want kids, you know you don't want kids, and if we engage in sexual intercourse, I might not get pregnant at the get-go, but eventually, except I'm sterile or I have like a fertility issue, I will take in at some point. You get what I mean? Yeah. So you have to have an agreement. If you need to like get a doctor's counseling, a pharmacist, or even a psychologist, or somebody like Mr. Robert here, because he has like an idea on the social implications, right? So they need to talk to somebody so they can find common grounds. If I'm not a therapist. If not, I would say, if I'm not willing to have kids and you're not, and you're telling me to have sexual intercourse without any form of contraception, then I don't think that relationship really works, because there's a breach in the communication there. Yes, there's nothing you can do. You have to choose. I said that there's about 15 that temporary methods of contraception. Then you have the permanent one. and that makes 17, right? So out of 17 ways to prevent pregnancies, you do not want anyone. I honestly feel you can't eat your cake and have it all, so that doesn't work.
Okay, pharmokoh, you're going to give us a rundown of those 15 types or 17 types. But I have a question for Mr. Robert. Mr. Robert, last week we had a session where we discussed the case of casual sex, and our guest speaker, told us that the ages of age was it age 12 or age 11 to 19 is where casual sex is quite high. So I don't know, what do you think? Coming from the social point of view, the information that these ages have about contraceptives is quite very poor, quite low. Is there a way to bridge this gap? And just in case we have some of those viewers watching us right now, because almost all teenagers now are armed with a cell phone, so they can. So what is the information for them, and how do you feel that they can correct or they can help themselves in this case?
Okay. I'm going to speak on this while merging the last question you asked her about the way to go about it and how people feel about contraceptives. It's an issue of normative ethics, which is basically just one's morality at a particular point in time. And our morality is largely defined by religion, right? If you agree with me. And
Yes.
The major religions, which is Christianity and Islam, in Islam itself, the Quran did not mention any place explicitly talking about contraceptives. But what most people hold on to is the part of the Quran that says you should not kill a child. But then, is it really a child? Which is the question you ask yourself. But in Christianity, I think the largest sect in Christianity, which is Catholics, explicitly said that contraceptive is wrong. The use of contraceptive is wrong and it's a sin, based on letters by various popes in the past. So, because of that, most of us that are guided by these said religions might not want to reason with you based on, okay, the consequences of not using contraceptives. And that is a major problem because these young people that you speak about, most of them are not independent of thought. So they are also guided by these religions. And the best way to go about it is still to have that discussion. Because then there's the whole thing of what you want to be, and then there's the reality of things. Because if you are talking about morality based on the religious context, then we should not be talking about casual sex, like you mentioned. So you cannot pass that stage and then revert back to religion when the consequences occur.
Okay. All right. That's quite very, 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 very. I don't know. You're trying to go into a very testy waters. I don't want to make comments on that. But the point is this: many persons in the country, or most of our viewers, are tied to affiliated to one religion or the other, and then most of these religious groups, they have their doctrines concerning the use of contraception. All right. Now, many of us, many times or sometimes, we are torn between either following these religious beliefs or pursuing our profession. Some patients, for the doctors who are listening, some patients will come to you and say they want to look for a way um, to prevent getting pregnant in the future. And if you're a Catholic as a doctor, you will be torn between either sending that patient away or referring the patient to a different facility because you do not want to reach your fate. So that's that for that. However, before we hear the list of the contraceptive measures or methods we have, for those of us listening, if you have any questions for any of the speakers, you can write into the comment section. And if you are yet to subscribe to the channel, you should just click the subscribe button and turn on the notification. We usually have these sessions every Sunday. Here we discuss issues concerning general issues concerning health. So, pharmokoh, you have the.
Okay, so I'm talking about the different contraception.
Yeah, just give a list, a rundown, so that.
Okay, I think I'll start from the most common one, the condoms.
Okay.
Yeah. So we know there's the female condom, there's the male condom. So like I said, it's probably most likely, or more than probably, almost factual or completely factual, the most safe method of contraception, because not only does it prevent pregnancy from occurring, it also prevents the transfer of STIs between partners. Then we have the contraceptive pills, of course. You have the combination pills and you have the single one, commonly called the morning after pill. This one is for the females. And I said there's the window, the index of 3 to 5 days after coitus before you take the pill. Then we have the one called caps or diaphragms. Now these ones,
Okay.
they're shaped like condoms, but unlike condoms, they are made from sort of like rubber. No, it looks there's another word for it, I've forgotten at the moment, but it looks like it's made out of rubber. Yeah, and then you put it just on the genital. So it prevents for the male now the inflow of the sperm into the woman. And if it's the woman that has it fixed, it prevents the sperm from getting into the private organ. But that one has a very high percentage, according to research, of causing STIs. So, in my opinion, it's not a very safe option for long term use. So, if you can set
Okay.
dates for couples or partners that have dates set for their sexual intercourse, I think you have to set your date, calculate, and know when to get it fixed and when to take it out so you don't like infect yourself or pass the infection to your partner. Then you have the contraceptive implants, which is it's subcutaneous, that it goes under your skin. They just inject it. That one cannot be administered at your pharmacy store. You actually have to see a doctor for that one to be put in you. Then you have contraceptive injections. Yes, most married couples, from my experience in the community practice, most married couples opt for the contraceptive injection. Yes, it's fast acting. As we know, injections go directly to the bloodstream, right? So it's fast acting, and they use it to space their children and then to prevent excessive reproduction, if we may put it like that. Then you have the contraceptive patch. As the name implies,
Okay.
is a patch that's put on the skin. Now, this one is not for long-term use as well. Yes, it has, I think, is it 2 weeks, about 2 weeks to 6 weeks thereabout. So it's administered, and then after that period, if you still are going to engage in coitus, you have to change the patches. Then I talked about the caps and the diaphragms, they're very similar. Then you have the intrauterine device and intrauterine system. These ones are
Okay.
also devices that injected into the reproductive organ. Yes, so for some people, this one probably sounds scary. So nobody will want to know they have something beeping inside them, and it's pretty expensive as well to get it done. So it's an option. Then there's the option of natural family planning. Now, that one would work for married couples as they are willing to bear children or they are ready to have offsprings, but they want it like spaced. You know, the thing when people say, I want the first child to like be about 4 before I give birth to the next one. And then the
Okay.
natural family planning, it's sort of like having a timetable for when you have sexual intercourse, right? So you have your first child, and then as a woman, you're able to monitor your menstrual cycle. So you know your fertile period. Yes, that's the period where you know you're ovulating. And if you have sexual intercourse at that point in time, the chances of taking in is very high. So that's what it means done naturally. It means there's no use of contraceptive pills, there's no use of the condoms or the devices or the patches. You're basically just monitoring your body, how your body works, your reproductive organs, then your menstrual cycle. Yes, and then in cases for men that have difficulty, we have dysfunctions in men as well. We have the erectile dysfunction. Then we have those that can't even erect at all. That one's a different ball game. But yeah, cases like that. So there are drugs that we give to such patients to help them with their erection. So that's where
Yeah.
the family planning comes in. So the woman now has to monitor when her ovulation occurs. So it guides the man on when to take these pills that help him erect and then ejaculate and probably stay as long as possible. Then I talked about the contraceptive pills already, where you have the combination pills and then you have the single pills. Then there's something called a vaginal ring. Now, this one is very interesting to me because I've only ever seen it online. I've never seen it in person. Yes, it's just as the name implies, it's a ring. And if you know what the female reproductive organ looks like or is structured like, so you know where the opening is. And so you just put the ring there. So what it does is it has something, from what I saw, it has like a blockage so that the sperm can't flow through. So it really goes, you have to like push it up. It's like inserting, I think it goes higher than a tampon even. It just prevents the sperm from going into your system. Basically, that's what that is. So those ones are the temporary method of contraception, if we call it that. Yes, and don't forget that they have a safety index. The condom is 99% from research, but the other methods are about 96%. So we still have that 1% tendency from the condoms if there's a tear. You know, there are cases where we hear, oh, I used the condom, but she still got pregnant. There's probably a tear. So you have to confirm these things before deciding to use your condom. Then the other ones too, there's usually no way to checkmate it to know if the window or there's a chance of taking in or getting pregnant. Then for the permanent methods, we have the female sterilization and then the male sterilization, which is also known as vasectomy. Now, permanent. So when we say permanent, it means there's no going back on this journey. So if you decide to get sterilized, it means you're never reproducing. So you
So
can have
is there not a way
coitus.
where they can store the sperm or something, like just in
Oh
case the
yeah,
man needs?
I think they do that for eggs. They do that for eggs, but for the sperm, no. Except there's some
Yeah.
like form of storage or preservation I'm not aware of. I know for the
Okay.
eggs, yeah, that one is very
Okay.
common now. We have people that do the is it in vitro is outside the body, right?
Yes.
So we know
Yes.
people like they store their eggs, they have them frozen for a while. Then when they're ready to finally use them, especially people that are like approaching the age of menopause, so they freeze their eggs, and then when they're ready, when they find say a suitable partner or a father for the child, they do that. But for the male, no. From what I've read, no, there's no way to preserve the sperm. Even if you're going to preserve it not for long, you can't compare the duration you can have the eggs frozen for to how long you can keep the sperm. Yes. So it's a permanent method and it means there's no going back. So if you opt for that, it means you can have your sexual intercourse as much as you want, whether 50
Okay.
times a day or 100 times a day, every day of the week, wherever, however you want it. And that one is a sure form of contraception. The chances of taking it is 0%, except where you had the procedure done, they actually did not sterilize the person.
Okay.
So yes,
Okay.
that sums everything up.
All right. Thank you very much. Thank you very much. Um, um, Mr. Robert, I think you have a question in the comment section. So let's go. You should see it now, right? It should be Mr. Robert. Will it be a good thing for teenagers to have access to contraceptives, considering that they are the most exposed?
Yeah, I think it would be the same way. You know, there are different outreach programs where they share condoms in school, for instance, because whether we like
I've
it
not
or
seen
not,
that in secondary school.
no, yeah, not in secondary schools, not in
Okay.
secondary school, in universities,
Okay.
because whether we like it or not, these things do happen, and it has always been happening. It's not a new thing where we have teenagers engaging in sexual relations. But in Nigeria, we kind of alienate that whole aspect of teenage sex, even though we know it's happening, where we don't speak about it. Even there's no sex ed in our curriculum. We've had different debates on having it, but it doesn't happen. But the best way to go about it will always be facing the issue because it's there in our face. And with all these activities comes the risk of pregnancy, comes the risk of getting certain illnesses. And like pharmokoh said, condoms is the safest way. So I feel the same way it is being um, carried on in universities should be in secondary schools. Although I'm not saying, okay, we should gather everyone from GS1 to SS3, for instance. No, we have certain age groups. And you even mentioned from 12 to 18, where he said, I think one third or two third are already engaged in casual sex. these are statistics here in Nigeria, not somewhere else. So I think it's really just the right thing to do.
Okay. All right. That's fine. From Oko, you
I
have a
have.
question.
Oh yeah, sorry. Just
Says,
before I take my question, I have a curious one
okay,
for Mr. Robert, right? When we say
okay,
teenagers, even speaking medically, right? There's a
yeah,
reproductive age or the age where we say they've reached puberty.
Yeah.
And I know over time it has reduced. It used to be considered 16 upwards, but now I'm pretty sure with the way the generation is going or people are growing, it's way younger now. The question was, is it good? Is it a good thing for teenagers to have access to contraceptives? I don't know. I feel like they need to be educated before they have access to it. So if they're going to have access to it, it should be on what's the word? On dicey grounds or shaky grounds. Like you
yeah,
have to be sure you know like the implication of what you're about to do. Because you know there are people that are misguided. So they probably just engage in sexual intercourse for the fun of it or for trend, or I saw it on TV and I want to know what it feels like. So I feel in my personal opinion now, it's not medical, like exposing teenagers, young teenagers, or making it giving them easy access to contraceptives probably makes it worse because we know they're doing things out of the trail, not out of understanding. And then if I know, oh, I can just have sex now, get the pill, it's fine, or just walk into any store, get a condom, they will definitely give me. It's really going to increase the rate of them engaging in sexual intercourse. Yes, except if they know they have to go through like procedures. Maybe first of all, you have to see a therapist that gives you the talk. Then you have to see a doctor that does like different tests on you, probably put stuff up your organ and all. It's going to reduce the rate of sexual intercourse in like high school or secondary school, like he mentioned. So I think that
okay.
that one
Uh,
about
uh,
making it
um,
accessible for them is really dicey.
it's really dicey. The other way to look at it is the fact that without this contraceptive, the pharmakoh, there is casual sex going on. And then we had a speaker last week who gave us a statistics of this sexual occurrence. The most popular and recent one is the Chrisland school. You understand now? Now the point
Oh
is,
yeah,
at
yeah,
what point at what point are we supposed to let these teenagers know that there is a way that you should not mess up your life. There is a way, just like the way the adults do, and understand the precautions that they can take to avoid getting diseases and getting pregnant. At what point are we supposed to let these teenagers know? So that is actually why that was why the questions were directed to Mr. Robert. I guess
okay,
this person watched our last session, and then with the comment
yeah,
Mr. Robert made just now, so he had to ask him that question directly because it's
okay,
quite dicey for me.
yeah,
I would constantly and routinely turn down any teenager who wants to have access to contraceptive
yeah, yeah,
for me.
yeah.
However, coming from the social point where Mr. Robert is coming from, I don't think he will agree with me. Mr. Robert, I don't know. What do you think?
I will not agree with you guys because there's always going to be a difference between what is ideal and what is real. And
Yeah.
Yeah,
constantly on the field, you see all sorts. There was this time we had this thing where we were going to different secondary schools to speak on, I think it's on VVF. Yes, on VVF. Then there was the question session, but I didn't tell them to ask me directly. I told them to just write it down on a piece of paper because then it will be more honest. And I was getting
yeah,
all sorts of questions because then VVF itself is not a discussion you have with only, let's say, SS3, because it's not too sexual on itself. It's a consequence of childbirth. And we're having all sorts of questions from these people. Some of them are from GS2. You understand? So even though, yes, ideally we should not, you say, okay, giving them access to these things will increase it. But it's not going to increase it. It will just make it safer because it's already there. And it's not, I know we would like to say, okay, this generation, but that is not actually the reality of things. It's just that now information is easily gotten. For instance,
Yeah.
if that Chrisland's case happened, let's say 40 years ago, you will not know about it. it will just be some people in that locale that will know about it. So it's not necessarily that, okay, this generation are more into sexual activities. We cannot prove that, but it's just that there's more access to these informations. And I've seen, okay, the consequences of these unwanted pregnancies. There was a girl I met on the field one time. She got crippled during childbirth. And she was, I think, 14. She was 14 years old. So, like I said, consequentialism is very important. Even though, yes, we'll say, if we say, okay, you have access to this, it's not really going to reduce it too much. It's just going to make sure that they have unhealthy practice and more unwanted pregnancies, more diseases.
Okay, we're almost running out of time. Let us take this question
Okay.
for Dr. Oko before we wrap up. Dr. Oko, is it advisable for both partners to wear condoms simultaneously? Wow, I think this person is trying to ask if the woman should wear a condom while the man should wear a condom.
Yeah.
He's trying to
Yeah.
play safe. This is quite too
Yeah,
safe, right? Don't you
that's
think so?
plain. Yes, too safe. I was going to say, like, this one doesn't want to hear that even that 1% or the 0.1% happens. No, it's not advisable. You know, pharmaceutical, you know what we call unnecessary medication under the
Yeah.
medication errors, right? Where
Yeah.
there's a medication that's prescribed for a patient, but it's not necessary. That's
Yeah.
what the man wearing the condom and the woman wearing the condom
Wearing
basically is,
condom.
because they do
Oh,
the same thing. Besides the fact that now the friction is going to be reduced, and then it might result in injuries, especially for the female. Yes, there's the unnecessary medication, like I mentioned, because both condoms do the same thing, right? And the thing about, should it be the male or the female taking the pill now? If I'm using it in the condom sense, this makes it easy. If both partners are willing to wear the condom at different times, respective times, then maybe you do Monday, I do Tuesday, you get, or vice versa. So no, it's not advisable for both partners to wear the condoms simultaneously. Is what we in our profession would consider unnecessary medicating. Yeah.
all right. So we're about to wrap up now. I think we're almost running up. Mr. Robert, I don't know. Do you have any questions for Dr. Oko so far?
Yeah, I have a question because I know you asked her earlier if taking contraceptives immediately after intercourse, and you said 3 times a week. But then there are people that have it more frequently than that. There are people that have that every day. You don't even need to be a sex worker, for instance. So let's say 7 times, like every day, even more than once a day, which we know there are people who do that. Is it advisable to take it every day? Is there any long-term or permanent side effect?
Of course, that. Okay. Let me allow Doctor.
Okay, you can give your input. Earlier when I spoke about the window, I talked about, like, it says even on the drugs have leaflets in the packs when you buy them. It says you should take it like max 3 to 5 days after sexual intercourse. So I was saying, like, it's still safe to take it 3 to 5 days, right? But it works better, or it's more effective if you take it immediately after. So which means the earlier you take it, the safer it is, or the more it prevents pregnancy from occurring. Then if you have sex as much as he said, there's what we call the combination pill. I think, from Ezekiel, you're familiar with that one. It's in a drug pack that you have day 1, day 2, day 3,
day 4.
But that one now is commonly used to manage people that have this PCOS, right? Because they have like symptoms of irregular menstruation, the monthly one. That's why I said about like being on that one now. If the person has like another side sickness or disease, it might get complicated or dicey for them. So that's why the single pill, the morning after pill, is mostly recommended. And taking it too frequently, I would say, is not advisable. I talked about the ranges of side effects you have. You have headaches. Some people really feel sick when they initially take it. That's the first time. With time, they adjust to it, or their bodies get used to it. Then you have the breast tenderness. Then you have the thing about your menstrual cycle shifting completely. And if you're not able to monitor your menstrual cycle, when we talked about the natural family planning, it means not being able to monitor your menstrual cycle means you do not know your fertile window. You do not know when you're ovulating. So if you're going to now like opt for that, you're going to have issues, because now you have to treat your menstrual cycle, balancing it back to it coming as it should, not later or earlier. And then, you know, they say periods last for 3 to 5 days, mostly, in some cases 7. So when you're taking contraceptives a little too much, you have people that they bleed for longer, or they bleed like it's like spotting. They just like spot and that's it. It's not exactly a circle. So you're not really able to tell if that's now your ovulation circle finishing and then the blood coming out, like the shedding beginning. So it's not very safe to take it all the time, in my professional opinion.
Okay. And again, is a Postinor is especially Postinor is an emergency pill. You understand
Yes,
that
it's
if
called an
every other
emergency
method,
contraceptive.
if every other methods you have tried to use has failed, then you can use sort of Postinor. So it's not really nice to be in an emergency situation all the time, Mr. Robert. So those people who are having sex all the time, they should look for a much more sustainable method of preventing pregnancy than resorting to Postinor every day. It has its own
Like the
side effects.
patch, the
Yeah.
contraceptive patch, you have the intrauterine devices, stuff
The
like that.
contraceptive patch, that is quite interesting. How many, what is the percentage margin of safety for that patch?
Oh, that one, I know it's, from what I saw, I checked NHS. NHS is for the UK. It's about
Okay.
88% to 92,
Okay. Well, I
thereabout.
don't think do we
Yeah.
have that in Nigeria? Have you seen that?
Interesting question. The part of Nigeria where I stay, I've not seen it. I'm going to put
Okay.
it
I've
like
not
that.
seen
So I don't know
I've not seen
if
that in
you
my
have.
part too. So I've not seen that in my part
Okay.
too.
Yeah, so
So let's just assume that it's not there. All right. All right. Somebody is asking a general question before we go. Mr. Robert, you're going to give me a closing remark, but let's take this question first. Um, General question: salt and water. How sure is it to avoid pregnancy? Wow, this is a new one. Pharmokoh,
yeah,
have you ever heard of
interesting.
this?
I'm going to take note of this one. No, I've never heard of this one. I'm not going to give examples of the one I've heard, so it doesn't seem like I'm giving people hints on things to try.
Okay, okay, yeah, yeah.
But
There are a lot of things that people use
yes,
to prevent pregnancy. A
interesting.
lot of this.
Yes.
Some
Pharmaceutical
go
was
ahead to buy
my
antibiotics and Z prevent pregnancy. Is that bad?
yes, we don't want to mention names like names of drugs or brands but yes, I've had
Yeah,
that to
yeah.
people come in and say they want to even like cut, give me two capsules of this, give me one of this, give me one of that, and they mix and take. And
And
apparently it works for some people, and you hear people testify
how
that,
will
oh,
it, I
it
don't
works for
understand.
them.
Pharmacopoeia, how do you say that works? That should be
That's why I said
coincidence.
apparently. Yeah, funny enough, there could be like an external factor that actually
Yes,
prevents the pregnancy, but they're probably not attentive enough to take note that that's what
yes.
caused it. So they probably just assume like, oh, it's the mix and match pills
And
that they had.
yeah, and I will have somebody who actually told me that there's a particular soft drink that also help prevent pregnancy. But just
I
as you say,
think
we are
I
not
have
where.
an idea. I have an idea the one you're talking about. Yeah,
It's
but
funny,
yeah, for the
but
salt and water, I've actually never heard. And if I'm
uh,
thinking, like, let's even do chemistry now, H2O, then
and
salt.
so it
Yeah, yeah.
doesn't
There's
have
no
any
there's no mechanism there.
at all. It's
Yes,
just
when
you're
it
gonna
comes
make
to
you just maybe try to get rehydrated. You just add sugar to it to be ORS.
yes. Nice
So
one.
thank you very much, everyone. Thank you very much. If you have further questions, you can ask it in the comment section. And while I go through it during the week, I would reply as much as possible. And also, I'll also send the questions that are relevant to the speakers to them. And then you just have to check back after 24 hours, and you see a response to your question if you leave a comment for us. So that's that for today. We want to really appreciate our speakers, Mr. Robert and pharmakoh. So, Mr. Robert, can you please give us a closing remark and then before we go?
Okay, my closing remark would be that it is always necessary to use contraceptives in premarital sex, and also even if you are wedded and you don't have children. And I've already spoken on the morality aspect of it. You cannot jump one hurdle and then in the next hurdle you are moral, then in the next one you are supposedly, according to our society, immoral. So we
Immoral.
should always, yeah, we should always know that the
I see what you're
consequences.
doing there. I see what you're doing there. So if you can be immoral to have sex, you should be immoral to be able to use a contraceptive, right?
Let's just go through with it all the way. Even though to
Okay,
me,
okay.
yeah, yeah,
So
like
what
from
if
our
after
previous,
the sex, what if after the
mm,
sex the person repents and then become more devout?
I think you should put your repentance on pending for a bit
I
after
would
you
say
put
after the
your
contraceptive.
yeah.
Interesting.
Because the consequences are there, like they're in your face. For instance, like I told you about that 14-year-old girl or
Yeah.
someone in the university, it is going to take a toll on you because you are going to take your normal life and then raising a child, which is a huge responsibility. So contraceptives all the way.
Thank you very much. Pharmokoh, I really appreciate your time. Thank you for the list you gave to us. But those of us who are just joining, there is a list of over different types of contraceptives that you can use. So you just have to go back and watch it all over again to know. If you have any questions, as I mentioned, drop it in the comment section. I will get back to you. So thank you, everyone. Thank you, speakers. Thank you, Pharmokoh. Thank you, Mr. Robert. We'll catch you next week,
Thank you for
same
having me.
time. Yeah, yeah. Bye bye.
All right, thank you.